the hammies, the hamstrings, okay? So what position are we gonna want our patient in?
Sitting.
Sitting, like this?
Short sitting, yes.
Okay. I will say this. You will very, very, if not most commonly, see it performed just like this in the clinic. However, there's slight issues with this. What do you think it is?
The hamstrings are slightly, or at that slight stretch. Could be. Yeah.
Well, they kind of are. The biggest thing is they're being compressed. Your patient's sitting on the muscle, which we know from, we've talked about before, we don't ever want to stabilize or squish the muscle that we're testing because they're not going to be able to function as well, right? So, even though it's seen like this in the clinic by just about everyone,
I do it all the time.
I've done it it's commonly done, right? It is not the ideal position. The ideal position, I thought I heard somebody say it, is going to be prone. So I'm going to have the patient lie down on her stomach. Okay? What this does is it takes any compression off of the hamstrings, okay? And allows them to function more properly. So, actually I'm going to use this side. I'm going to get her about there. Okay, first I want her to go through full range, right? Go ahead and bend your knee as far as you can. Yay, she did it. And then I'm going to take her through that motion and I'm going to get my end range. Yay, I did it, okay? And then I'm going to get about right here, if not a little bit farther down, towards extension, okay? The hamstrings are strong muscles. So we want to have a little bit of advantage, but not so much, we're not going to be like here and cranking down on them, right? We're going to be here and applying just like this, okay? So I want her to hold that position, don't let me move, okay? Notice what she's doing with her toes.
She's using the gastroc too.
She's using the gastroc too. She's pointing her toes, trying to get that gastroc to help out with knee flexion. So, cheater, pumpkin eater. We want her to keep her toes in dorsiflexion, or at least neutral. We don't want to, if we start to see them go into plantar flexion, we know that they're trying to get that gastroc involved. Okay? So, you don't necessarily have to use your anterior tib or anything, but try and do without pointing your toes. Okay? Just keep them in neutral position. Here we go again. Much better. 5. Good. Okay? 5 out of 5. Easy. Okay? What do you think, just because we want to stick with what we've been doing, is going to be a position for gravity minimal or grade 2? Because let's say that she's down here and she gets about right there and then she can't go any farther.
Sideline.
Sideline, okay. Do I want her, I'm testing her left side. Do I want her on her left or her right side?
Right.
Her right side, okay. Go ahead and lie on your right side for me. There we go. Now I'm going to hold her, start in knee extension, and then just, again, I'm supporting her, I'm not helping her, I'm not resisting her. I want you to go through knee flexion. There we go. And she went all the way through, so I can give her a 2, right? And if she only gets part of the way through gravity minimum position, what do I have to give her?
A 1 or less.
1 or less, right? If she starts to go through it at least, I know I can give her a 1, right?
Yeah.
If I can't feel anything, then I give her less than a 1 or a 0. Okay, so that's knee flexion. So now let's move on to knee extension. What do you think is going to be the ideal position for knee extension?
Johnny,
Yes.
so we should test patients in that position for knee flexion, or do you think we're going to end up testing them sitting?
Oh, you mean like in the clinic?
Yes.
In the clinic, you honestly can do whatever you want. I'm not there to grade you. I'm not there to correct you or anything like that.
So skills checks, though, we want them prone.
Skills checks, we want you doing everything the way that we taught you. Because again, that's the ideal position and way to perform that test. Okay? Out in the clinic, we have no control of that. Like Greg and I said, we both have tested knee flexion in the sitting position. If you're treating a 90-year-old grandma and she can't get prone, you test it in a seated position. Document that you did in that position, but
Is that gonna have a big effect on their range of motion? Having that slight compression on the hamstrings?
range, probably not. Strength,
Or for the strength test?
it can have at least enough. It can change the test. Yeah, the rating you give them. Yeah. Whenever I do the test, I'll try and lift them up a little bit so it's taking compression off, but sometimes you just can't, and you deal with what you got. So, yeah, in the clinic, kind of whatever you do. Here for pass offs, we want the ideal position. Okay. Knee extension, or what muscles? Quadriceps. Okay, all 4 quads are going to be performing the motion of knee extension. What's the ideal position, do you think? This one is sitting. Okay, just like this. Yay! One thing that you don't want to do, well, we got to stabilize, right? Do we have to really do much as far as stabilizing our proximal end? No, the table's right there. Right? But again, we got another hand that's doing something, so we're not just going to be like, right? One thing we don't want to do with it. What do we not want to do with this hand?
Not that.
Don't want that. Okay? Because even if we think, oh, well, I'm not going to like pinch down on it, we're probably going to compress a little bit, and then it's going to make her have a harder time going into knee extension, or without knowing it, I'll end up doing that. And again, she's not going to be able to contract appropriately. Okay? So a couple things you can do. You can either stabilize your patient, because to compensate for weakness, they might try and lean back. So we're going to stabilize at the back. Or, because of the position that we get the knee in, as we push down and she resists, it can be very uncomfortable to have your back of your leg being pushed down into the table. And so you can slide your hand underneath there a little bit to elevate it, as well as to make it a little bit more comfortable for the patient. Okay. Now, with knee extension, what happens at terminal knee extension?
There's rotation.
Screw home mechanism, right? It locks into place. Once that's locked into place, in conjunction with the strength of the quads, did I tell you guys the number? I can't remember if I told you the number.
No.
Okay. Oh, now I can't even remember the number. I can't remember if it says in your book or not. I had it written down on my cheat sheet, and I lost my cheat sheet. So the quads, specifically when going down stairs, does it have it? Oh shoot, I don't think it has the number. Oh, it does. Okay. It says, in stair descent, the forces transmitted through the knee are equal to nearly 3 times the body weight, necessitating a greater magnitude of strength than can be detected in a manual muscle test. So, in order to resist that amount of force being placed on you, and to be able to control the motion so you don't just and fall down the stairs, your quads have to be able to resist that strength, which means that they're strong muscles. Okay? So the strength of the quads combined with screw home mechanism, if I were to put her in this position and tell her to hold it while I applied resistance, even if I apply and give myself the most advantage as much as possible at least, go ahead and hold it there. Her butt's going to come up off of the floor or off of the table before I'm able to break that knee, before I'm able to break her contraction, okay? So, to give ourselves that mechanical advantage, not only are we going to keep our resisting hand at the ankle or the distal end of the segment, but I'm going to actually take her out of screw home mechanism, okay? So, get my nice ninja stance here. Put my hand under there for patient comfort, and then I've got terminal knee extension here. I'm going to come out of the terminal knee, go and relax. by about 15 to 20 degrees. So about right there, okay? And I'm gonna tell her, hold it there, don't let me move you, okay? And I apply my resistance. Now, my body's completely over. Good. Easy 5 out of 5. You notice my body was completely over her leg, but I wasn't leaning into it like that. I was using just my arm to push down against her, okay? With this one, a lot of people have a tendency to lean over and try and use their leg to overcome or overpower that quad. That's not the purpose, right? We're trying to match their resistance and see if they can hold it there for 5 seconds. And if they can, then we give them 5 out of 5, okay? So, grade 2 position. Say she can't go through full range against gravity. What position do I need to get her into?
On her left side.
On her left side, because I was testing her right, okay? And I'm gonna start in knee flexion. And then again, just supporting her, not giving her resistance, going straighten your knee out. Okay, and she kind of went into internal rotation. Make sure they're in neutral, because if they go into internal rotation, then gravity's helping them go into, okay? So we keep them in neutral, start again. And she made it, yay! So then I could easily give her a 2. Okay, any questions on knee flexion and extension?
One hand's always under, you're saying?
If it's uncomfortable for the patient. I mean, I could have tried it without, and seen if it was uncomfortable for her, and then I put my hand under there. But then I also need to watch out that she's not trying to lean back. If she is leaning back and I still want to put something, I can put a towel under there, just so that I can have my hand to support her back to cue her to stay neutral. Okay, good question. Any others?
Could
Okay.
you have her
Oh.
put her hand behind her back and stabilize?
You could. Yeah. Yep. Okay. Go 2.